morning break. Go ahead, Mr. Neff.
Okay, Dr. Catellier, where we left off was essentially, I was asking you if you could begin to walk us through your autopsy of Miss Cloe Chandler. Like I mentioned earlier, if you wish to use any of the admitted exhibits from the first trial, we'll be readmitting them under the same exhibit numbers. So if you reference them, project them to your screen on the Zoom call, and that way we can all see what you're referencing, and we'll know which state exhibit it will be.
I'll try to share. It says that the host disabled screen share.
Let me attend to that. Apologize. Did that rectify that, Dr. Catellier?
Yes.
Sorry. If she doesn't, I'll make sure to interrupt.
So do you see the larynx diagram?
We do, Dr. Catellier, and just for the record, Dr. Catellier is projecting Exhibits 55B as noted, or as numbered from the prior trial.
Just to review so that it's easier to appreciate what we're going to look at. This is a cartoon of the larynx. After the skin has been reflected, that is the midline of the front of the neck. The muscles are a little skinnier on this diagram just so that you can get an appreciation for the entire anatomy. They are actually in life closer together. These are what we call sternocleidomastoid muscles. Those are the big muscles on the side of the neck that you can see when a person turns their neck from side to side. In the center here are the muscles that we call the strap muscles. One goes from the sternum or the breastbone to the hyoid. That's called the sternohyoid. And peeking out from behind there is a smaller one that goes from the sternum to the thyroid cartilage. And then a smaller one that goes from the thyroid cartilage to the hyoid bone. In the center, this is the Adam's apple, which is part of that thyroid cartilage. And you can see it's kind of shield shaped. This is another view of the neck. The sternocleidomastoid muscles have been cut away here, and underneath them you see first layer is the jugular vein, that's in blue. We see some smaller muscles, the omohyoids, but then centrally the strap muscles. Again, this is the sternothyroid, sternothyroid, and thyroid.
And just, Dr. Catellier, if I may interrupt briefly for the record, the moment you said this is another view, what's being displayed now is State's Exhibit 55C. You may proceed, Dr. Catellier.
Thank you. Again, peeking from behind, you can see the thyroid cartilage, a smaller cartilage called the cricoid, with this smaller little muscle called the cricoid muscle. You can see the trachea poking out, and then this is the thyroid gland. This is another view of the neck with the muscles taken away, and you can see the carotid arteries. They're on both sides of the neck, just against the larynx, which is this whole structure, with the shield of the thyroid cartilage, the hyoid bone, the cricoid cartilage. And then behind is the vertebral column.
And so, Dr. Catellier, for purpose of the record, I'll just interrupt you briefly. This is State's Exhibit 55D, which has been referenced from the moment Dr. Catellier noted she was looking at another angle of the neck. Now, if you could, Dr. Catellier, using exhibits of Cloe Chandler, essentially that are photographs taken during your autopsy of her, could you walk us through what you found as far as the structures that you've just referenced and how they presented on Miss Chandler herself?
Yes, it may take me a moment because my arrow is my mouse is not wanting to leave my laptop screen, which is where my camera is, to get onto the screen with the exhibit. So it's a little cantankerous. If you'll bear with me, I think I can get it. It's not cooperating. There we go. My mouse keeps disappearing for some reason off of the big screen. This is Exhibit 56, which is an external photograph of Chloe's neck as it appeared at autopsy. This was actually the day after autopsy. It's often the case that once blood drains from the body, the ligature marks or other injuries will be more apparent. So this is a close-up of her neck. It does show a ligature furrow. This is an abrasion. This is upwardly canted. And in the front, it's more horizontal. We see several sites of paleness, pallor, which may reflect it reflects irregularities in the ligature, consistent with a twisted ligature, so that we're seeing areas of contact with the folds of cloth, which tend to be pale, and surrounding that more erythematous or red areas of bruising and abrasion. We also see some pale outline marks in series. They're very subtle, but they likely represent finger marks. They're consistent with that size and shape, such that if a hand were put into the space between, or the potential space between the ligature and the neck.
As far as the ligature itself, you noted it's irregular. Well, how does that inform your understanding of what you're seeing in relation to the three different types of strangulation being manual, hanging, or ligature?
Well, this is a non-specific finding, but the fact that it's narrow, in other words, only about a centimeter or two in height, suggests that the cloth was compressed somewhat. The story that she had been hanging through the legs of the canvas, which would suggest that that ligature could be more broad and soft. And again, when we look at the studies by Patel and the other study from India, where Patel's cases had 320 cases of hangings and 80% of them had soft material. They all had ligature marks, but not much in the way of contusion. Only in 20 out of 320 cases did they have internal necking. I would expect if a child with a relatively light weight compared with an adult hanging from a ligature made of a soft material that is fairly broad, as one might expect with the crotch of pajamas, I would expect minimal injury, although a furrow is certainly possible. And I would also expect it to be more uniform and broader. Again, this is just one feature. It's relatively non-specific, but still of some concern with the story given. You can see that there's a changeover on the right side from a broader furrow to a more narrow one, which suggests that there was a narrow surface area on this side. Again, either the ligature being bunched or pushed upward or narrow in that location.
And Dr. Catellier, you can move on to State's Exhibit 57 and continue to discuss the ligature mark.
These are additional views of Chloe's neck. This is viewed from the right, seeing more of that narrow component of the ligature furrow, and then again the broader furrow with the areas of clearing representing irregularities in that furrow, which would reflect irregularities or folds in the ligature that was utilized.
And then if you could walk us to State's Exhibit 58.
58 is a close-up of the front and left side of Chloe's face. These are those subtle marks that we reviewed on the top right of her neck, and this is the left side of the face. Again, a close-up of the midline of her face. You can also see some little probable abrasions here of the skin that would be consistent with marks from nails. Again, a close-up view of these pinpoint abrasions, areas of clearing, bruises, and the ligature furrow. In close-up is Exhibit 60.
Now, as far on State's Exhibit 60, Dr. Catellier, those abrasions, in your career, do you find those in a complete suspension hanging as they present here?
The abrasions can be the discrete abrasions, and I've lost my mouse again. I'll work on it. The pinpoint abrasions that are around the oval marks are consistent with little scrapes from fingernails. We see them not too often, but certainly they are not unusual in hangings or ligature strangulation, as usually the victim attempts to remove that ligature reflexively. Sometimes we see them in manual strangulation with a perpetrator having nails that are pressed into the skin as well. So they're not unusual. I think, again, the shape of this furrow is a bit unusual for a flop ligature, especially one that was described as having a broad surface area, and as would be what I would picture with pajamas used as a ligature with crotch, the surface that is weight bearing.
And then you can move on to the next slide, Doctor.
I may have to do that without the arrow. Again, I'm having trouble that my mouse keeps wanting to go to. Hold on, I'm going to put the laptop down. Hopefully the mouse will go onto the screen if I take the laptop screen away, so you'll lose my face for a minute.
Okay, is it okay if I leave my face off of the screen until we get through these exhibits?
Dr. Catellier, I will admit the sound is pretty muffled, and I believe we also, just in complying with the finding of the court as to how the Zoom call would go, will need you visually present.
Okay, well, hopefully this will be all right then. I got it at least on the right screen. This is Chloe's neck from the left side with a little bit different flight. Again, there are...
And this is State's Exhibit 61 for purpose of the record.
This is State's Exhibit 61 with ligature furrow, areas of clearing, likely reflecting alterations in the texture of the ligature. This is the back of Chloe's neck as seen at autopsy. There is a furrow here, but I believe this is more than likely from a neck block that was placed behind her head by the Iowa Donor Network. This is State's Exhibit 62. State's Exhibit 63 shows some abrasions of the surface of her gum. They're very subtle, pink, likely from her teeth pushing against her lip. State's Exhibit 64 also shows Chloe's face with some abrasions on the top left side of her inside lip. This is an identification photograph, Exhibit 65, which simply shows her face and identifying number. She does not have petechiae that are definable on her face. Again, this is a different angle of the ligature furrow in Exhibit 66. Exhibit 67 shows the furrow coming up on the left side of Chloe's neck onto where the jawline is on the side, on the left It's narrow here, again indicating that at the sides of the neck there is less surface area of the ligature that was in contact with the skin causing pressure. It suggests that the ligature was more narrow. It's not diagnostic of that, but certainly suggestive of smaller surface area contacting the skin. This is Exhibit 69. This is a photograph of the top of Chloe's head. This ruler shows that the feet are toward the left of the screen. The scalp has been surgically incised or cut on the back of the head and then pulled forward. On the right side of the screen is the bone of the top of Chloe's head. There are 5 circular bruises that are visible in this photograph, and these would be these 2 at the top would be at the top of her scalp. Recall that the skin is pulled forward, so this is just about the top middle of her head, and the next one would be a little behind the ears on the top of the head, and then these on this side. The top of the head is relatively protected, so it's not as common to see injuries there in the course of typical play. Of course, that can occur, but these are blunt force injuries. I don't know their significance. Exhibit 70 is a photograph of the front of Chloe's neck after the skin has been reflected. So, to the right of the screen is where the little notch, we call it the jugular notch, which is a little dip between the collarbones in the front of the neck. It would be approximately where that number 18 is. And then this is just the soft tissue under the skin of the reflected skin. And then down here, this is about where the collarbones would be. Excuse me, this is the top here is the neck. So under the 18 would be where the hyoid bone would be.
Now, Dr. Catellier, there are 3 arrows on this exhibit, Exhibit 70. What do those point to?
Those show areas of injury. And the arrows are there because the injury can be subtle. On the right sternohyoid bone, there is a little hemorrhage that is just a few millimeters in length and probably less than 1 millimeter in width. Above that, there's one that is closer to a centimeter in length, a little bit wider. In retrospect, I believe there is some subtle hemorrhage in the midline here adjacent to that, although I didn't appreciate that when I saw it with my eyes at autopsy. Sometimes photographs will show additional findings, but these are definite hemorrhages that were evident when the skin was reflected. This is the sternocleidomastoid muscle, that big muscle that turns the head on the neck, turns the head that we see on the front of the neck. There's a hemorrhage at the end of the arrow, and there's more diffuse hemorrhage above that. So hemorrhage on both sides of the neck, in a first layer strap muscles.
At least in terms of categorization of strangulation, manual, ligature, or hanging, though it may not be dispositive, how does this inform you slowly getting to the point of categorizing?
Can you ask that a different way?
Yes. These three injuries on State's Exhibit 70, what do they inform you about the asphyxia and strangulation? What do they tell you about that event, at least in terms of Chloe? Though I recognize it may not be dispositive, what does it point to?
Well, first of all, it shows that there's neck injury. This is the first layer of the neck. In and of itself, hemorrhage of the sternocleidomastoid muscle and a few streak hemorrhages of the sternohyoid would not necessarily be unexpected, but in a child they are distinctly unusual. And again, I think there's probably additional hemorrhage across the upper sternohyoid in the center of the neck as well. Sometimes with pain deaths, this part of the sternocleidomastoid, the superior aspect, will have some hemorrhage. Sometimes you see hemorrhage down below as well. It's described in lots of paintings. I tend to not put a lot of emphasis on the lower hemorrhages. Although they are described in the literature, they can also have a component of autopsy artifact. I believe they're likely related to injury, but they may also have some autopsy artifact. The neck can have a bit of pooling of blood where the edges of incisions are, and this is where, this is where the edge of one of the incisions was, and so I don't categorize that.
And just for clarification, the points that have arrows to them, of those injuries with arrows, would those be artifacts as well?
No.
So when you note lower hemorrhaging, those would not be falling into that category, correct?
Correct.
If you want, you can move on to State's Exhibit 71.
State's Exhibit 71 is a side view of the left side of Chloe's neck, showing that sternocleidomastoid muscle with quite a long streak of hemorrhage. It's just a better view of the hemorrhage that we saw in the previous Exhibit 71. This is Exhibit 72, which is on the right side of Chloe's neck, again giving us a better appreciation for the extent and distinctness of the hemorrhages on the right side of her neck. Exhibit 73 shows the superficial layers of muscle pulled back. Sometimes we'll see just hemorrhage of the deep muscle. In other words, we previously saw the top of the muscles nearest the skin. Sometimes we'll only see a little hemorrhage and strangulation death on the more deep side of the muscle. Sometimes we'll see it all the way through. This is the sternohyoid muscle, where we saw a streak of hemorrhage on the anterior or superficial side, but here we see more diffuse hemorrhage there. There's hemorrhage of the sternocleidomastoid muscle deep on the left, and a strength of hemorrhage of the sternocleidomastoid on the right. Recall that with the superficial view before reflecting the sternocleidomastoid, there was no hemorrhage visible on the right side. So we have bilateral hemorrhage of the sternocleidomastoid, hemorrhage of the sternocleidomastoid. And there's also some straight hemorrhage we see here through the muscle that is the the thyroid muscle, and below that, the sternocleidomastoid muscle, or sternothyroid, so we have sternothyroid, thyrohyoid, sternohyoid, sternocleidomastoid, soft tissue hemorrhage, both sides of the neck in multiple layers of the strap muscles.
As far as, using State's Exhibit 74, which looks like a different angle of what you were just discussing, these black arrows, what is the purpose of using the black arrows as opposed to the white arrows?
I ran out of white arrows. It's just a different arrow. They don't show a different type of hemorrhage. They're just also there to illustrate the hemorrhages.
However, those two black arrows, they point to injuries that were not shown in State's Exhibit 70 and 71, where only the white arrows were showing, correct?
Yes, because in State's Exhibit 71, the sternocleidomastoid muscles, the sternohyoid muscles, and the omohyoid muscles had not been yet reflected. And here they're reflected to see the deeper muscles. And this is, as you correctly ascertained, State's Exhibit 74 shows a close-up and side view of quite extensive hemorrhage within the thyrohyoid muscle, which is deep on the left side, as well as the deep sternothyroid muscle.
And Dr. Catellier, what is the significance of finding such significant hemorrhaging deeper within the neck?
Strangulation injury, as I mentioned before, is often without any injury at all, particularly in children. Hanging injury is usually without any hemorrhage at all. And when it occurs, it's more frequent on one side of the neck rather than both sides of the neck. So in this case, it's very unusual to have hemorrhage within not only the sternocleidomastoids, but also the muscles of the larynx at multiple levels, particularly in a child, particularly when the history is of a hanging. Recall that hemorrhage is due to friction and change of forces enough to cause injury. And so with a hanging, because loss of consciousness usually occurs rapidly, which is why children become entrapped and sometimes have accidental hangings, because when that pressure gets against the neck, the carotid arteries are compressed. Loss of consciousness occurs very quickly, and without someone there to extricate the child, to lift the weight of the head away from the ligature, hanging is often completed, but there's so rarely hemorrhage, and rarely hemorrhage on both sides of the neck.
Thank you, Doctor. If you could move on to the next slide.
State's Exhibit 75A shows hemorrhage with lifting the sternothyroid muscles. They were over the thyroid gland in the last photo. This is the thyroid gland. There is a small blood vessel which is intact here. This is not a hemorrhage. This is a normal blood vessel. But there is hemorrhage within the muscle itself. Again, an additional layer. We didn't see that hemorrhage on the top side of this muscle, but on the bottom side there is hemorrhage. With reflection of the thyroid muscles, those short, flat muscles at the top, it's evident that not only on the left, where it was prominent before, but also on the right, there's hemorrhage that is deep. And this is not just streak hemorrhage, as we often see, and which you've seen in the last exhibit, but it's more diffuse. It's over a length of about 1 centimeter, but also a width of about half a centimeter or more on the right. This is not insignificant for strangulation.
Could you explain, Dr. Catellier, on State's Exhibit 75B, why it matters that that hemorrhage is diffuse as opposed to more of a streak?
It's just more hemorrhage.
And in what form of strangulation do you expect to see this type of hemorrhage?
A strangulation where there is displacement of the tissue, usually with a force that is moving. So there is compression with movement or significant pressure over a small surface area. So I would expect to see hemorrhage, for instance, if strangulation occurred because of a heavy object with a short, small surface area, like a bar over the neck. I would expect to see hemorrhage if there's movement, such as would occur with a struggle or friction applied. But again, although you can see a little hemorrhage in a hanging, probably associated with the ligature slipping a bit or moving a slight amount. To see it on both sides of the neck, to see it at various levels, and to see it in a child are all unusual, unexpected.
And another question concerning this hemorrhage, is it more likely to, and I think you may have already explained this, but is it more likely to come from a specific pinpoint pressure or the more consistent, regular pressure from a ligature and a hanging?
I'm afraid I don't understand your question.
And correct me if I'm wrong, in a hanging, the pressure from the ligature is more diffuse around the neck, correct?
In general terms, yes. It would be expected to be more uniformly distributed, depending upon the ligature used, but most often, yeah.
And the injuries that are exhibited on State's Exhibit 75B, are those consistent with a regular wide-bearing ligature force applied, or are they more consistent with more of a pinpoint pressure applied, as in, just examples off the top of my head, like you said, a bar, a finger, things that press more specifically on the neck?
I think they're most consistent with some kind of friction, probably movement, or you could see this with very firm pressure from an object with a small surface area, such as fingers or a tool. But again, very unusual to see this pattern in a hanging.
Thank you, Doctor. If you want, we can move to State's Exhibit 76.
State's Exhibit 76 is a photograph of Chloe's neck after the larynx has been removed. So that voice box and the strap muscles have been removed. And this is the vertebral column in the center of the photograph above the letter M and E. And adjacent to the vertebral column are the carotid arteries. They are lighter in color than the veins which accompany them. They're more tube-like, so you can see their structure, although they're flattened in depth without blood going through them. They have retained more of their tube-like consistency, and over the bottom part of them is hemorrhage. And this is not just the very bottom where I said you can have some artifact. This is moving up the neck about a third way to the top of the spring. This is hemorrhage around the carotid artery sheaths. We look for that, and when we see it, it's a very concerning sign for strangulation in any death, and bears explaining, because it's rare to see that, especially low in a hanging death. In a hanging death, usually the ligature slips up to above the level of that highway bone, or at least between the thyroid cartilage and the highway bone. Whereas in strangulation, the injury can be lower. So seeing this hemorrhage of the carotid arteries is consistent with force being applied a bit lower in the neck than is sometimes seen, and to an extent that the depth of the neck is affected, and it can be well appreciated how blood to the brain would be limited or constricted because of this kind of injury that reflects the compression of the carotid artery.
You can move on to State's Exhibit 77, Doctor.
State Exhibit 77 is the side of Chloe's voice box or larynx. Recall that the shield-like thyroid cartilage has horns or cornua that stick up on the back side, and this is the part that sometimes gets fractured with strangulation. It sometimes gets fractured with hangings. It is much more often fractured in adults than children because it turns to bone as the person gets older. There was no fracture in Chloe's neck. Again, injury at all is unexpected. But we can see there's hemorrhage adjacent to that thyroid cartilage cornu. And that reflects pressure in that area, and that it's easy to see how that would be an area that would be fractured because there's hemorrhage in that location reflecting a force in that area. This is another view on Exhibit 78 of same tissue that we saw in Exhibit 77. The thyroid cartilage, the shield-shaped cartilage, is seen from behind the right cornu is under the arrow corresponding about to the number 7 at the top of the screen. And on on the opposite side, the left side of the thyroid cartilage, is visible the cornu on the left. So the cornu on the right is at the bottom of the screen, the cornu on the left is at the top of the screen, and it's evident that there's hemorrhage on the inside of the thyroid cartilage as viewed from the back. So this is the posteromedial or back and central part of the thyroid cartilage that has hemorrhage. And again, hemorrhage on both sides of the neck.
Now, Doctor, as far as these types of injuries, just going back to the literature that you've referenced, how common were these types of injuries seen in Cloe Chandler in comparison to the strangulation or hanging deaths in the literature you've referenced?
Well, for example, an author named Ma, M.A., from Shanghai, wrote a paper about hangings and strangulations. It was published in 2016. And they looked back on their caseload and found a total of 46 hangings and 171 strangulations. So, of those, the sternohyoid muscle, recall that front scap muscle, was found to be hemorrhagic in 3 out of 46 hangings, and in 50 out of 171 strangulations. So about a third of the strangulations and about 3 of the hangings. And these are not just children, these are all of these cases that they went back and looked at. The sternothyroid muscle, the next longest muscle in the front of the neck, was found to be hemorrhagic in 3 of 46 hangings and 46 of 171 strangulations. The sternocleidomastoid, those big muscles on the side of the neck, was found to have hemorrhage in 8 out of 46 hangings and 31 out of 171 strangulations. The thyrohyoid muscle, the little bitty one at the top that we saw hemorrhage on both sides of in Chloe, was hemorrhagic in only 4 out of 46 hangings and was hemorrhagic in 23 out of 171 strangulations. Now keep in mind that all of these hangings and strangulations didn't necessarily have hemorrhage in all of those muscles. With Chloe, we saw 5 different hemorrhages of the sternohyoid muscle, one hemorrhage of the sternothyroid, 5 little areas of hemorrhage in the sternocleidomastoid, big ones on the side of the neck, and 3 of the thyrohyoid. So there are more hemorrhages than expected for a hanging, and certainly more than expected for a child, because children tend to have much fewer sites of hemorrhage, and often none, in cases that should involve neck injury.
Thank you, Dr. Catellier. You can move on to the next state's exhibit.
State Exhibit 79A is a photograph of the inside of the larynx, or the voice box. At the top of the screen, centered under the exhibit number, are the vocal cords. On either side of the tissue are seeing that fibroid cartilage that has been cut from behind so that we can see the inside of the larynx. And here on the surface of what we call the mucosa, or the skin of the inside of the voice box, are multiple petechiae. Those are something that we look for with a strangulation death. These petechiae in this location are rare and hanging. Again, petechiae are always non-specific, but we look for them here when we're concerned about a strangulation death, because strangulation, like any diagnosis, involves a compilation of multiple findings with the history in order to determine what is consistent with that history. In State's Exhibit 79B is a similar photograph as 79A. However, I have cut into the vocalis muscles, that is the muscles of the vocal cord. And gross hemorrhage, in other words, hemorrhage we can see with our eyes, is visible on both sides of the larynx within the vocalis muscles. I believe that's all. No. State's Exhibit 80 is a photograph of the back of Chloe's neck. In the center of the slide, oriented horizontally at about the level of the H and the S in the identifying ruler is her vertebral column. This is where the bumps on the very back, of the middle of the back are felt. They are parts of the vertebra. And on the sides of the back of the neck are hemorrhages on the right and the left. The back of the neck is evaluated layer-wise as the front of the neck is. Exhibit 81 shows a deeper dissection of the back of the neck. Between the arrows is the middle of the spinal column, again where those bumps occur, and between vertebrae, all the way between the bones of the spinal column, there is hemorrhage.
Now, doctor, as far as the back of the neck, what is the significance of finding injury here?
It shows that there was enough hemorrhage or enough force to cause injury both on the front and the back. And again, if a hanging death is one that is with a ligature causing compression of the front of the neck to suspend the neck via the weight of the head and or body, hemorrhage of the back of the neck would not be expected. Exhibit 82 shows the same tissue from the opposite side. There are few hemorrhages in spotty location, and at the tips of the arrows on the left, it's more difficult to identify within that muscle that is just against the spinous processes of the vertebral column, which is those bumps in the back of the neck, but because of the shadows, it's difficult to see them. There is hemorrhage at the tip of the arrow location. And that concludes my autopsy.
If you want, Dr. Catellier, I guess just end the screen projection. Now, Dr. Catellier, after you conducted the autopsy, after seeing the hemorrhages you've presented us with and explained, what conclusions, if any, or decisions came about in light of the history reported?
Do you mean at the date of autopsy, or?
Yes.
Well, at the date of autopsy, I expressed concern because, as I mentioned, even with adults, having any hemorrhage in the neck with a hanging is unexpected. Or at the very least, a small amount of hemorrhage might be expected. To find hemorrhage on both sides of the neck, at all layers of the strap muscles, within the vocalis muscle, along the carotid arteries, as well as in the back of the neck, suggests a struggling force. This is much more in keeping what we see with strangulation. And so at this point, I wanted to know if there was more information that would explain the findings, something that I had not heretofore learned of, such that I can correlate my findings with the history and be satisfied that the physical findings made sense with the history, because at that time, I did not feel they were.
And when you use the term strangulation in this context, it seems, and correct me if I'm wrong, that it is implicitly strangulation by an act that doesn't involve hanging solely. Is that correct?
It doesn't involve simple hanging, yes. In other words, just suspension by the neck with a broad cloth ligature, as was initially described.
As far as the scene, was there any significance to the vomit that was noted coming from Cloe in your findings?
Well, it would be unusual to see vomiting in a victim of hanging. I don't recall having seen that, and of all the studies that describe findings in hanging, I have not seen it in the literature. It's possible that it was there and it was not described. In the Indian literature, in multiple papers, they talk about a dribble of saliva being common in a hanging. That's something that they specifically say is characteristic of hanging. But because a ligature pushes the tongue up, the tongue is actually a muscle that's quite thick, and is that part of that muscle is just under the skin that is under the chin. And so the tongue gets pushed up and out. Oftentimes, with a hanging, the tongue will actually protrude from the face or from the mouth. So vomitus will be described in the airway because there is a common opening between the trachea, or the windpipe, and the beginning of the esophagus. It's actually in that area just above those cornua of the thyroid cartilage. And so gastric contents, stomach contents can come up, but they usually go back down the airway in a hanging death. Whereas one of the features of strangulation deaths, in other words, manual strangulation in particular, because of that intermittent injury, loss of urine and bowel continence, and vomiting are described. So the fact that there was vomit was another puzzling variable that was not in keeping with what I would expect of a person who was suspended, removed from that suspension, and was not alive at the time they were examined. So that was another unexpected finding.
Your Honor, it would appear our connection is frozen.
That did not. Can you hear me?
Dr. Catellier, yeah, maybe give it a few seconds so that the speed catches back up. You were noting that the vomit was not in keeping with the history. I think you were elaborating, but that is when it cut off.
It was not what I would expect with the history given.
Now, given Chloe's weight and size, would violent muscle spasms during a hanging account for your findings in the autopsy?
Not in a typical hanging death, no. As we discussed, even with a larger person having seizures and posturing, it's most frequent that we don't see any injury at all. With the child left.
And we'll get to the purpose of this question, but what is von Willebrand's disease?
It is a disorder of blood clotting that runs in families, and victims of it can sometimes bleed more than other people.
And if you could, walk us through what Cloe Chandler's medical records discussed about von Willebrand's disease and how that ultimately came into play in your findings.
Yes. Throughout her medical history, from the time she was a toddler on for a little bit, there was description of von Willebrand's disease. She had had some nosebleeds and was evaluated for that, and so the doctors did a number of tests on the ability of blood to coagulate or clot. And one of the tests that they did was borderline positive for von Willebrand's. And so through her medical record, there were references to her having von Willebrand's disease. She was referred to the University of Iowa for specialty consultation because of that. And subsequently, additional studies by the university and examination by the specialist in the coagulation or blood system of the body found that she indeed did not have von Willebrand's disease, that they specifically thought that her bleeding was likely the result of trauma, in other words, probable nose picking, that she, further testing that they did showed not that there was a borderline positivity for von Willebrand's, but it was negative for von Willebrand's, so they felt that the one positive test was a laboratory error or an insignificant rise in that factor, and she was specifically diagnosed not to have von Willebrand's after quite a complete workup.
And so,
Mr. Neff, I'm going to stop you there. We'll take our lunch break and resume at 1 o'clock.
Dr. Catellier, if you did not hear that, we're taking another break. And you said 1:30 or 1, Your Honor?
Oh, 1 o'clock, 1
1
o'clock.
And we'll resume at 1 o'clock.